this episode of Nurturing Wellbeing with Kurt Kelly, I have two guests with me today. First, I have Molly Tierney. She was the commissioner in Baltimore, a person that has unbelievable experience and had great results in working in child welfare. She's been one of our keynote speakers at the conference, and I'm very excited about hearing from her. But along with her is Dr. Laura Boyd. Dr. Boyd is a renowned expert in the behavioral health world. I first met her in Washington, D.C. as we were up there working on some things on the Hill. I think you're going to really enjoy this conversation between two real subject matter experts on nurturing well-being with Kurt Kelly. Molly and Laura, I just want to thank you guys so much for being a part of this conversation. And first of all, let me just say, Molly, we heard you speak this morning at our keynote. And by everything I heard from everybody, you just knocked it out of the park. I was sitting behind you, so I couldn't behind the screen, but I was listening to you. But just the questions and people were asking. And I think what you really captured the attention of a lot of folks was your willingness to say that we've got to get beyond the status quo. I want you to camp around that for me a little bit. Let's talk a little bit about how maybe how child welfare is perceived, because perception usually turns into policy at some point in time, how child welfare is perceived. And then how do we start? Because we're not going to kick it away. We're not going to throw it all away. And that was one of your points this morning. You're just not going to just do away with it. We're going to need someone. What can we do to continue to move this area into new areas, especially as we look at FFPSA in their prevention aspect?
Thanks for having me. It was really great to spend time with your team this morning. They're really a remarkable group of people. Their energy is up really high. I think this is such an impressive question about child welfare. One of the challenges we face is that we use one word as a culture to mean so many things, right? And we haven't really clearly defined what it is. Many things to many different people. In my mind, its core has to be, how can we teach the country how to better care for each other? And how can we notice the earliest signs that any of us are struggling so that we as an entire community can take some kind of action that might help turn that tide, right? And this is tricky for child welfare because for many decades, the work has been get the call, go judge the family, take the kid, put the kid in foster care, that's better, leave the kid there. And that it is time, in high time, for us to admit, while well-intended, it didn't work, right? It didn't work for the families that were separated. It didn't work for the kids that spent their childhood in foster care in temporary settings, right? It's not working for foster parents, it's not working for kids, it's writ large, it is not working. And I have the sense that could we get more honest about that? Could we just say, okay, well, that's the truth. That's a truth that we have to name and hold. Then we could embark in a loving fashion on, well, what would we do then? What would we do differently if what we meant to do was keep far more children safe at home, intervene long before we have to do something catastrophic like separate a kid from their parents? And I don't think there's a silver bullet for that, but I think loving on the question a lot is going to lead to lots of answers then communities can pick up.
When I picked the name for the program that we're doing called Nurturing Wellbeing, I kind of camped around it for a while. I didn't want to call it fostering because that has connotations. And I didn't want to say child welfare because that has connotations, as you're just saying. And even the concept of welfare gets all caught up into the political world, and it connotes these ideas and so forth. And well-being is a term that I think people are beginning to move towards, saying we look at what is the right thing for a child. I can tell you this right now. There are times when we have to remove a child. There's no options. But there's going to be trauma involved in that no matter what you do. And so it's really interesting for me to interview a lot of different folks. And we've been doing it. I have groups of legislators that are getting ready to pass policy. I've had national folks on. I had Rick Santorum. We were talking about the Family Leave Act. I've had several legislators that have come in Florida as we're looking at policy to talk about that. And it's interesting to hear their perspective. Laura, you have been in the legislature in Oklahoma, not here in Florida, but in Oklahoma. And bless your heart, you ran for governor. Yeah, and I said that, bless your heart, because that's a challenge. And you and I first met in D.C. I was up there on the Hill working on the FFPSA issues. How do we move this conversation? It's one thing to move it to a general population. It's another thing to move it to the particular conversation of folks that are in the system of care. We got to do a retraining of that, a reimagining of a lot of that area. What about the political class? Talk to me a little bit about that.
I think you're well on your way with your leadership, frankly, here. And I'm delighted to be a part of this conversation and to be here with you. But one of the things I see you speak to is the positive nature, the hope, I love it that you said we're healers in this business. And it's that whole focus, I think, that we have to really maintain. And I think it's the one that with politicians registers as well, because that doesn't divide us. Now, they may not see themselves as healers, but I think on the issue of, we know families are important to them, period.
Everybody.
And so when we talk about things like families, that families are so stressed today, there's so much stress. How do we know they want to be good parents and we know they love their kids. How do we help them remove some of that stress so they can be the parents they want to be? Is it they need education? They need to learn a parenting class? Is it they need a job? Is it they need a car? Is it that they need help with a drug and alcohol?
That may be one of the problems that a lot of people don't understand. A lot of the times these families are in crisis. And some say, well, it's a crisis of their own making, but it's still a crisis, whether it's drugs or alcohol or those kind, there's abuse in that family. And even our system of care, if they see something like that, they believe, oh, got to remove the child. I'm not sure I think we're beginning to make that message that we can come in and intervene and have some interdiction programs that can keep the child in the family. And I'm actually seeing a thawing of the hardness of people. You say, well, that's their problem. They shouldn't be like that, and begin to say, we understand it, but we don't want to exacerbate a problem by removing the child and putting them into a system as well as it's intended to be. Is not as good as it could be if you had the right family environment and so forth.
I think you've got it exactly right there. I think we just have to keep framing it, and we have to keep saying that child maltreatment is a solvable problem. It's a solvable problem. We know how to solve it. Now we need some tools and supports to be able to continue to do that. But we have those answers, and we need you, our leadership in Congress, to be a part of that community, that bigger community that makes it possible for us to solve this issue. You've done a lot of it. You've already done it when you've helped us with the FFPSA. That was a good start. You've done it when you helped us in this coronavirus period to have some fiscal supports for families to get them through all the millions of changes, no matter whether the family could work or not work. You've helped us really look at child well-being, and you've helped us nurture child well-being. And we need you to continue to do more of that.
Molly, as she was talking there, and I was hearkening back to your opening. I'm sorry, I wish I had it. I wrote it down when you said it. But we can solve this. We can solve these problems. And I think there's a lot of times to say, well, it's just child welfare. It's bad. It's a horrible thing, and we're never going to fix this. I don't like the defeatist attitude. We're never going to have it not where there's not a problem, but we can certainly gain momentum to begin to make these systemic changes in the process. Again, we're not going to have a panacea. It's never going to be perfect. Until they make perfect people, we're always going to have issues. But I think that becomes really the concentration that I've been really trying to get our folks to say is learn from one another. And I actually think Florida is uniquely positioned because of our community-based care to be these models of innovation. The states are supposed to be the laboratory of democracy. I believe that Florida's community-based care is the laboratory of innovation and can utilize the differences. Because, man, there's a lot of difference between Miami and Pensacola, Jacksonville, or my hometown, Ocala. You guys are the experts. You've been out there and you speak all over your experience in a very difficult, challenging area of Baltimore. Let's talk about some of those changes that you see are on the horizon that you had to have the courage to begin to start saying, I'm going to challenge some of these old status quo. Should I have given you that question ahead of time?
No, it's good. It's good. We're all friends here. I think that the hardest labor was oddly getting everyone willing to look boldly at data. I know that sounds really wonky and geeky, but there is something about we have to count. Well, how many kids are in foster care? How many came in last week? How many left? Like, is the number leaving greater than the number that came in? And how much of this needed to get done last week or yes, or whatever the thing is that needs doing? And there was a real reluctance to do that because there's fear maybe of, oh, I'm going to get in trouble. Like there's fear. I don't know another way to say it. They're afraid they're going to get in trouble. And it took probably almost 2 years to get everyone to lean into it's okay to read the tea leaves and then say, oh, now I know what we have to do. Now I know where we have to move resources. Now I understand where the problem is and how we can fix it. It was oddly a real challenge for people to get comfortable doing that. Part of that is just emotional. The other is data is really hard to get, and that has to stop. It has got to stop being so hard to learn what's working and what's not working in child welfare.
And in every industry that has moved forward and taken, as they have been data driven. And so here was the dynamic that I used to see, and I still see this, is the wonkiness and almost the cold analytical side to looking at data, because this isn't data, this is children. Okay, that's one side. And then the other side is, oh, but I love everybody and I just want to take care of kids. And that's important. You got to have the heart, but you got to have the knowledge. And I think when those two begin to meld and we begin to say, but the data is going to drive those who have that compassion and love. We're not asking to have less. We're showing that we're going to be able to make better movements and better outcomes. I'm a little concerned sometimes when government, go back to you for a second, Laura, but when government sees it, sometimes they see it as a cost effective. You know, when community-based care came in place, there was a lot of people says, we can do this and save money. The truth of the matter is, when we came into the system of care, for the first 10 years, we didn't get a penny of recurring revenue into the system. So that means we were at zero-based budgeting. And people were modifying their conversation by saying, well, that was what it was all about. No, it wasn't. It was about having better care, learning from the communities,
That's right.
utilizing that. And I had to come back in. It was the first thing I started looking at in the budgets. I'm like, where's the recurring revenue? We're at the same level we were 10 years ago, and this state is growing, fastest growing state in the union, or one of the fastest growing states, and a very diverse population. So I try to remind legislators when I'm talking with them, it's not about oh, that's nice. Yeah, it is. And I appreciate that. And it's not just about the hard numbers. There's a combination of that. From a political side, how do we move that?
I think that's so important to do. And you bring up a real life experience I had with Senator Tom Colburn. And Tom's passed away now, but he was known as Dr. No. We had a kid bill up for him, and he put a hold on the bill. It worked and everything was supposed to move along, and this senator comes and puts a hold on the bill. And I went and talked to him, and I said, Senator Coburn, I know this is a very difficult values moment for you, because I know you don't believe that our grandchildren's futures should be mortgaged to debt. And I know how much you care and love your family. In fact, he had an adopted daughter, your family, and you're having to make a very difficult decision. I hope you will make that choice to remove your hold so that in the immediacy we can move forward with what our kids need. And thank you very much for listening. He did remove his hold. 2 days later. But I think the difference there was in recognizing the value of the conflict. He does care about families. He cares about fiscal, budgets. But putting that back on him just with acknowledgement helped. And so if that's a real world story, I think anytime we can validate both sides, that makes it a little easier for people to hear us.
And the hard part that I keep reminding our folks here in Florida, and of course I have a Florida perspective. I get a lot of calls from different states saying, how are you guys doing this? We really did make some great movements here in Florida. I think over the last 5 or 6 years, we've kind of plateaued about that, partly because there's always this desire for government and bureaucracies to, once again, the new word is accountability, and everything's accountable. What that means is you get government intervention and that kills the innovation and the creativity. So we're constantly having those conversations and trying to say, I like the fact there's accountability, but we need to make sure that we're still the innovation and creativity.
I think the same is with data, because we do need data, and data does drive things, but there is an academic type of restrictive data that does not account for innovation and applied experience for which we get certain data. So I think we have to look at that as well. One of the things we've gotten away from, in my opinion, with the design of FFPSA is that state flexibility you're talking about. And until we can bring that back so that states have more flexibility to try what they believe works for them, just like, and then show their outcomes, just like you empower families by supporting them to try what they think works for them. And then you're there for accountability or for more support. Until we get back to that, we're really slowed down our progress. However, the value system, the pointing to prevention instead of removal, that's there. And that is just so mammoth.
Absolutely. I'm going to come to both of you with this sort of as we wrap this up, because it helped me this year as I was working with the legislature. We had the largest increase in funds that we've ever had. It was unbelievable. I wish I could take credit for it. I know we had a plan to go after it in an amazing way. But one of the things that caught the attention of the legislature wasn't just about child welfare. It was about the child welfare workforce. So I'm agreeing with you that sometimes government's good at putting all of these, we have our OPAGA studies and, they come in and they take a look at the numbers and so forth. But we forget that we have to have a good workforce that can implement this thing. What are you seeing? You were commissioner in Baltimore. So there, you could never get away from the workforce and the quality and the level of that you had to have to implement all these great ideas and stuff that you're learning. Any secrets that you came out of that on how to both recruit, retain, grow and mature, educate a workforce?
This is a great question. Someone said once, oh, your staff in Baltimore, they follow you and they really respect you because they know you were a caseworker and then you understand. I said, no, I don't think that's why. I'm going to tell you why. Because I loved every one of them. I loved them all day, every day, right? And that love meant I made sure they had what they need to do their jobs. They weren't struggling to go out at night because the state couldn't figure out how to buy flashlights or get the pencils out of the locked cabinet, right? I broke all of that stuff so they had the things they needed and they felt supported. And I was a huntress. I was hunting constantly for what's working, because I think it's in your mind and it's in your mind. And when I can find, oh, this is a very interesting idea that worked. Should we be doing more of that? Can I help nurture that and give you the space to bring it to life? I think those things created an environment. Because, we worked a miracle in Baltimore, and we. Anybody that thinks Molly did it, that is some foolishness. It takes a we. What Molly did was create a container that people could step into to do good work.
And by the way, Molly, I love the fact that you don't shy away from the word love, and we don't misuse it. We recognize that it has multiple meanings in the original language, in the Greek, but in ours is with family love, and there's a philia brotherly love for one another. Workforce, just camp around. You have a national perspective that I see you working. What do you see that we can learn from maybe some other areas and better practices that have been taking place that would help us really build our workforce?
We have problems in most states right now with capacity for workforce and with burnout and those sorts of things. And so it really is a national problem. I think one of the things, again, is when we bring people into the field, we might even look, this is blasphemous, but we might even look a little more carefully at what is their motivation. Is it just because they need a job, which is certainly legitimate? Or is it that love, that passion they have? And if that ingredient is there and you can combine that with a kind of supervision or leadership, hopefully both, that can nurture their growth, I think that's how you retain. Now, one of the other areas that I'm seeing that we're looking at very carefully in some pilot programs in different states is we've also made it difficult in most states to be a social worker or to be a child welfare worker unless you've got a master's degree and 3 years of supervision and blah, 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 blah. So trying to protect quality is certainly important, and safety, of the worker and the children, all of that. But when we consider some other models, like using a qualified professional who has a bachelor's level and has these other supports, we open up a much more diversity in our workforce. And if we open up that diversity, we're finding in our pilots that people don't need to move on as much. They're not worried about getting their master's to stay involved, to get this or that. They're loving the work. And therefore we also can better match our workers to the families we serve.
6 years ago, the coalition commissioned a study, and we basically talked to every single one of our case managers. We did a survey of every one of them, of over 300 focus groups to understand the psychographic understanding of who wants to be a caseworker. The findings were amazing. And we need to do more with it and then just study this, but it was amazing. The Child Welfare Institute just finished a 5-year longitudinal study of why people leave. One of the things I went to the legislature this year in asking for the request was saying we have some areas 50 and 60% vacancies. You can't do your work in that. Now I'm going to get worse because people are going to leave. And so we made the argument. They heard us. They provided resources, not only for that, but also then to begin to bring the caseloads down, be able to do some things. So all of this conversation can often, when the citizens are listening to this, they go, I kind of lose what you're talking about. But they shouldn't, because what they should understand is when you have compassionate professionals that get their field and understand it, and that's why they're in it, and you give them the support mechanism and a vision for the future where they can grow in their profession, they're going to have long, because they didn't come here because they thought they were going to make, $2.2 million. They thought they were going to make that $45,000 to $50,000. They're like school teachers in a lot of respects. Guys, this has been fun. We could sit here and talk a lot.
Sure.
And thank you so much. We appreciate it. I look forward to working with you on a national basis in a lot more areas.
Thank you, Kurt.
Thank you so
It's
much.
a pleasure.
I think, as you saw, the interview I would classify as a very smart interview. These two folks are extraordinarily knowledgeable. But with their knowledge, they tie their passion, their love, and their commitment to the work that we do. I hope you've enjoyed this episode of Nurturing Wellbeing with Kurt Kelly.